Hi everyone. I'll just wait for 1 or 2 minutes for everyone to log in and then we can get started. If you need to get a drink or anything, please feel free to go do that and to come back. We'll just wait for a few more minutes. Oh. What I'll check is if the chat is enabled, because sometimes it just automatically disables itself. So if I do ask any questions, or if you want to ask any questions, you can feel free to post in there. So if someone's just able to say like hello in the chat, or just to know that, just for me to know it's working. Perfect, thanks Maliha. Yeah, Selena, you raised your hand. Is there a question? How are you? I'm good. I'm on Easter. It's Easter holidays at the moment, so it's a good break from uni, which is nice. Okay, we'll wait 1 more minute, and then if there's no one else, I'll just get started. Okay, I think we have enough people, and it's 2:03 now, so probably best get started because there's a lot to cover. So this session's about the medical school application process itself, and just basically taking you through what you need to do, and also in university what the course structure is like and things like that. So just a little bit about me. So my name's Shruti. I'm one of the 4th-year medical students, and I work with SixMed. I go to University of Bristol, and my main medical interests at the moment are endocrinology, so things to do with hormones, and then ophthalmology as well, so eye surgery, but also medical eye stuff, and then interventional radiology, which is doing some interesting procedures with like nanoparticles and things like that. And medical education and teaching, basically. So those are all my different interests. Not sure yet what I want to do when I become a doctor in the next year or so, but these are the ones I'm currently interested in. So a little bit about my journey into medicine. So I got into so I applied for medicine when I was in year 13. Before that, I already knew I wanted to do medicine because I just really enjoyed the sciences. So that was my sort of initial spark. And then I decided to do some work experience in obs and gynae, so with pregnant women and newborn babies. And I just really enjoyed medicine in general. So that's what sort of drove me to apply to study medicine. I applied to Bristol, Cardiff, King's in London, and also St George's in London. I had interviews at all of them, and I decided to choose Bristol because I just really liked the course structure and the fact that the clinical contact was much earlier than compared to other universities. And it just, from what the students had told me, it just seemed to be a very good university. So that was my reasoning for going to Bristol. Since being there, I'm currently in my 4th year, but last year I also intercalated, and I intercalated externally in Imperial, and I studied endocrinology. So that's why my interest in endocrinology is on there. And I really enjoyed that year, taught me a lot about research. And then now I'm back in medicine, and next year I'll be graduating. So yes, that's my journey into medicine and what I've been doing since I've got into medical school. So there is a question in the chat. So, hi, can you cover dentistry at the same time too? I'm not sure we directly cover dentistry, but when it comes to like talking about UCAT, BMAT, and like what type of work experience you do, I think the pathway to be able to like secure work experience and how to do a BMAT and UCAT is the same as the medicine pathway. So that will be relevant to you as well. So hopefully you still find it useful. If you have any specific dentistry questions that I'm not able to answer in this session, it might be worth maybe emailing SixMed themselves, so team@sixmed.co.uk, to ask them those specific questions. So the first thing you really need to ask yourself, as I did when I was in your shoes, is whether medicine is actually for you or not. So a lot of people, I think you watch stuff on TV and on social media, and I think medicine in general is quite glamorized, but in reality, it's quite a difficult job, and there's, you know, it can be emotionally demanding, but also physically and mentally demanding for some people, and it may not always be for everyone. So a few people who did think they really wanted to do medicine have decided to go a different route since intercalation. So people who are in my year, and that's completely fine, but it's really important to sit down and think whether medicine is actually for you, because it is a big commitment. It's one of the longest university courses, but also one of the most difficult like career pathways because of the amount of things you need to do in order to become a registrar and then a consultant. So it's a very long process and requires a lot of commitment, a lot of lifelong learning. But obviously it depends again on the specialty you decide to go into. So you need to sit down and think, is this actually for you? Which is a big decision to make. And obviously a lot of the time you will be either extremely sure of it or maybe slightly unsure, or you definitely know you don't want to. So it's just about actually sitting and having that conversation, whether that's with yourself or with other people, and discussing whether or not this is actually for you. Okay, so what are the reasons to do medicine? Before I go onto the slide, does anyone want to shout out what their reasons are for their interest in medicine? Just say it in the chat. Yeah, so Katie says diverse nature. So yeah, that's really good. You do see a very big, you know, variety of demographics. Again, it depends on the specialty you go into. So if you do obstetrics and gynae, you'll be seeing women mainly, but also transgender people as well. We're starting to see them now. But yeah, and then if it's pediatrics, it will be children. So yeah, it'll be specific, but again, it's still a diverse. If you do general medicine, it will be obviously people of all ages, people of all different backgrounds. Job security, yeah, it's a good thing. You do have a lot of job security, and it's also quite transferable across countries. Yes, you might need to do some exams to get into your job as a doctor in other countries and get the license, but it is still recognized everywhere. Andrew Huberman, very cool, want to become a neuroscientist. Okay, interesting. I don't know who that is, but that sounds interesting. Okay, you'd love how science and social sciences mix to get the results to help people. Yeah, that was one of my reasons to go into medicine as well, being able to apply that medical knowledge that you learn from a textbook into what's happening to a real patient, being able to explain that in patient-friendly language and also treat them and, you know, help them improve their quality of life or get better in the cases of surgery. Someone else said great mix of sciences, but also humanities. Yeah, humanities is a very big thing. They do take that. They do put a lot of emphasis on that in Bristol. So they make you do lots of projects in first year, which mix with arts and the sciences, and you have to do like artwork in relation to the medical issues you see, because they want you to see how art, the humanities and medicine are quite closely interlinked. So that's really good. Sense of accomplishment, yeah, again, that depends on which specialty you go into. So if you go into neurology, for example, you may still have some sense of accomplishment that you're helping improve their quality of life if they have Parkinson's disease, for example, but you're not necessarily going to cure the disease. Whereas for surgical stuff, if you fix something, then, you know, you're more likely to have improved their quality of life, but also have fixed the issue as well, depending on what type of issue it is. Make a real impact on people's lives. Okay, someone said Andrew Huberman, neuroscience professor at Stanford, famous podcast. Okay, interesting. So yeah, all of you have lots of different reasons as to why you want to do medicine, and a lot of them seem to be quite personal and based on your experiences, which was really good to see. So some of the things that you might have said are help people. Every day can be something new. So this one I give with a bit of a warning shot, because yes, when you first start doing medicine, every day does seem like something new. But once you specialize into an area of medicine, obviously there's going to be some repetition and some level of know what my schedule is going to be like. You're not going to have too many surprises unless you do things like emergency medicine or emergency surgical procedures. So those will obviously be a bit like sort of, I guess, a bit more adrenaline inducing compared to something like, oh, I'm going to have XYZ clinics daily, or on Tuesdays and Thursdays, and the other days I'm going to be doing this. So you will develop some sort of a schedule eventually, but yes, in the beginning, everything will be sort of, in a way, something new. Large variety of careers. So as I said, I've already mentioned a few specialties like endocrine, ophthalmology, and interventional radiology. You can also go into medical education whilst doing internal medicine. There's anything you really want to do, there is probably some space in medicine to be able to do it. If you're really interested in medical technology, you can do that on the side alongside the specialty you're doing. So things like radiology, or things where there's lots of advanced technology, like in cancer research and that kind of stuff, you can get involved in the technology side of things as well. Or if you enjoy things, hobbies like diving or sports medicine, then a lot of people do anesthetics, and then or they do emergency medicine or sports medicine, and then they're more likely to do a little bit of research into diving and hyperbaric medicine as well. So anything you can think of, there's probably an area in medicine which you can get involved in, and it is quite interesting compared to other careers. You do get involved in a lot of leadership and problem solving. So leadership, along with that, goes teamwork as well. So in medicine, you can't really work on your own. You're working in a team to help patients. It's a team focused job. You do a lot of problem solving. I think somebody else mentioned that. You do tend to be an expert in your field. It depends. So if you're a GP, you tend to know a little about a lot. So you tend to know a little bit of everything about a lot of different conditions that people generally come to see you for. And they're usually patients' first point of contact. But then if you're doing a specialty, so say ophthalmology or renal medicine, so kidney medicine or heart medicine, then you're going to be a specialist in that specific field. You work with a lot of different people, people who are really leading in their areas of research, and you learn from each other and you improve on what they've done through their research. So it is always changing in medicine. Again, that links with the research aspect I just made. No essays or lots of essays, so this depends on the university you go to, really. So Bristol, in first year you have one essay, in second year you have one essay again, I think. So in first, second and third year you have an essay each, and they're all related to research projects that you get to choose depending on which area of medicine you're interested in, from a list of things that they offer each year. So some of the things that they've offered, which have been quite cool in Bristol, are you going to the French Alps and looking at sort of altitude and how your lungs and your cardiac sort of function changes depending on how high the altitude you go up. So they all got to go to the French Alps. Sorry. I think I was just speaking too quick or something. Okay, let's continue. And then the other kind of things you can do are like emergency medicine and get involved with actually shadowing the A&E department, or I think you can do surgical stuff and learn surgical skills if that's what you're interested in. So there's lots of different things to do. In third year, people were able to do diving medicine. So they went to Malta, and they were able to see how, again, the lungs sort of change in a hyperbaric versus a hypobaric environment. So you can do a lot of different things, really, depending on what your interests are. But if you're not sure, there's also some general things you can get involved in. Whereas in other universities, there are lots more essays to do. So things like, I think in Manchester or some other universities, you have to do a short essay or several essays or pieces of coursework, which then count towards your end of year exam. but obviously I'm not specifically sure about it. So have a look at the individual university websites. So if you enjoy essays, it doesn't really matter which university you apply to, but if you really don't like essays, then obviously be quite tactical as to which university you apply to. Okay. If you're thinking that medicine isn't for you, what are the reasons which maybe put some people off medicine? So it can be quite a stressful career. It's not just stressful once you become an F1 and F2 doctor. It can also be stressful in your later years of medicine or your earlier years of medicine, because it can be quite, medical school, I mean, because it can be quite sort of taxing having to see patients who have really difficult conditions and then go back home. It can be emotionally quite difficult. In general, it's also stressful because of the demand in healthcare at the moment, and the fact that we have a problem with the A&E crisis, but also because we don't have as many people who want to stay in the UK and more people are leaving, which means that the people who are left behind are having to do the work of 3 to 4 people. So it can be quite stressful once you become a doctor as well. Again, that links in with a large workload I just mentioned. It does involve antisocial hours, so similar to nursing, similar to veterinary science, similar to I guess some other sort of careers. You do have to do night shifts, and you do have to do on calls. So night shifts, obviously, as the name says, it's just working the opposite of a normal shift, whereas an on-call is I think it's working a long day, but you will have the bleep, so you're expected to if any emergency comes up, you're the one who has to run and sort of solve it regardless of what ward it is. And that can be quite stressful in your first year as a doctor, so as F1 and an F2, to learn how to do that. And obviously working antisocial hours means you have less time to spend with family, or maybe you might have to cancel more plans than what you were initially hoping to do. As I said, emotional cases, again, long degree as well. So I obviously opted to do an extra year and intercalate. So technically this is my 5th year out of 6, because I decided to intercalate. So 6 years is a long time to be studying, and you'll notice people who are your non-medical friends tend to graduate and then they leave, and you're still at university whilst they've started working, and it can feel a little bit like a bit daunting that you're still at university, but obviously it's designed in a way to train you the best as possible, the best you can be before you become a doctor. So, but that can be, again, emotionally a bit taxing. Again, it's a lifetime of learning and exams. I think I mentioned this as a good point, but it can also be a bad point, because studying for exams when you're in your 30s or, late 20s or whatever it is, it can be quite emotionally difficult, because you're also trying to get other things in your life sorted, like your family and getting on with the rest of your life. So having to jump through hurdles with exams for each step, so from becoming a registrar, so from becoming an F1 to a registrar, and then a registrar to a consultant, just means that you're doing so much studying on top of working during the day as well. So yeah, it's difficult, but that is the way the job is, and it's just how it is if we want to help as many people as we want. So I've told you the good things, I've told you the bad things. So some people might still be unsure. What can you do to try and decide whether you do want to do medicine or you completely don't want to, is your work experience. So I know a lot of people have been struggling with work experience because of COVID, but you can do online work experience, which I think is counted to the same level as in-person one. And you can also do volunteering in an elderly care home, or working as a healthcare assistant, which all will count as medical work experience. Okay, reading books. I didn't personally do this, but I I guess it helps some people because I know that some people who applied at the same time as me did read several medical books. So obviously one of them is like, this is going to hurt. It's not necessarily the happiest read, but it does give you a realistic insight of what medicine is like. We've got a few questions. High expense of medical school could also be another reason. Yeah, I guess so. I guess it's more of an issue for international students than it is for home students, because for home students, for the first 4 years, you do need to pay for your tuition fees. But for year 5 and 6, so the last 2 years, the NHS pays for you via the NHS bursary. Obviously, if you're an international student, they won't. But if you're a home student, you do get tuition fees paid for. Not your maintenance stuff, but your tuition fees, the 9,250, is paid for the last 2 years. And the reason they do that is to make it even to other degrees, non-medical degrees, which maximum can be 4 years in length. And so when you come out of medicine, you all end up with, or any other degree, you'll all end up with the same amount of loan, which I think is a lot fairer than us having to pay for 6 years. So the last 2 years, the NHS do pay. Or if you're doing a 5-year degree, the last year, the NHS does pay. How many volunteering hours a week ideally? That is not something that I can give you an exact number on. It's more about the quality of the volunteering you're doing more than the quantity. How do you talk about these things in a personal statement? I would keep a work experience diary and just write down notes, like bullet points about the most important things you've seen. If you have seen anything quite good, which affected you or impacted you a lot that day, and then just keep a log of every time you do work experience or volunteering. And yes, it's difficult to write it in a personal statement, but you're going to have to shortlist and pick 3 or 4 of the best examples to discuss. But that's why I always advise people to start their personal statement early and write a lot of drafts. Again, online courses you can talk to lots of medical students. So people like me asking Q&A, coming to these sessions, talking about specific medical schools with specific medical students is also useful. And ask lots of questions in general when you're on open days and things like that. Best online resources for work experience. I think there's the Brighton and Sussex Medical School one. That's the main one that I know. If anyone else knows any other online work experiences, if you could just put that in the chat. Does it matter if you've just one work experience? No, it doesn't. When do people typically start writing? I started mine, so the deadline is 15th of October. I started writing mine on the first week of September, so I had enough time to redraft. But some people who find it really difficult to essay write will start earlier, so last few weeks of August, just so they have enough time to redraft. What do you think is, I've just answered that. Okay. So what's it like studying medicine? So I'll give you a little bit of an overview. Usually in most universities, it's split into preclinical years and clinical years. So your preclinical years are your years 1 and 2, and clinical years are years 3, 4, 5, or 3, 4, and 6, with the 5th year being your intercalated year, or the 4th year being your intercalated year. Intercalated year is usually a research year. It's classed as a year outside of medicine. You are still doing medical related research, but you're learning different skills to what you would in a medical degree. In that you learn a lot about statistics, medical statistics, how to interpret papers, how to decide whether research is good or bad, and also learn to write papers yourself. And if you're really good, be able to publish your own paper as well, and from your dissertation that you've written. How do you do independent research in high school? Is it recommended to do so in the first place, or is there any other way you could research? You could do an EPQ if your university, if your school offers that. If they don't, you can just do that on the side. You can do online courses to see, I think in Future Learn and things like that, you can do free courses to just learn about medical stats. But other than that, you don't really need to do much of that. You just need to show an interest in medicine, which you can do by work experience. So with your preclinical years, it's usually the basic sciences. They get everyone up to speed in terms of knowledge about the human body, because some people, when they're applying to medicine, do not have A-level biology. And so they want to get everyone on the same level. So the first year is just to get all of you up to speed. The kind of things you will learn is anatomy, so you'll learn to dissect and also learn about the different structures within the body and their functions. So anatomy hand in hand goes with physiology, which is learning about the functioning. And you learn about what's normal, really. What does this organ look like in a healthy person? So everything you're learning will be learning about stuff in healthy people. And you'll learn about embryology, so how does a fetus develop and all of that, and all the stages of the embryo developing and things like that, and which week does the heart start beating. So you learn a lot of interesting things. And then you will learn about physiology of the heart, physiology of the lungs, so how do they function. So things you've learned in your A-level and GCSE biology about respiration and all of that, you will learn in much more depth in university, and you'll actually find that a lot of stuff you learn in A-levels are slightly wrong, but then they will correct it for you once you come to medicine. I think they try to simplify it in A-level, but actually they've said it in the wrong way. But you will come to learn everything properly once you come to university. And then you learn about genetics. And again, it will go back to the A-level biology stuff that you guys did about chromosomes and about autosomal recessive, autosomal dominant, all of that kind of stuff you'll learn about. And yeah, I'm just trying to think back to first year. It was such a long time ago. I'm trying to think what else you do. And then you'll have some clinical work experience as well, where every Thursdays or every Wednesdays, this is what it was in Bristol, you will spend half the day in GP or half the day in hospital seeing a patient with a certain disease, like a heart condition or a lung condition, or a diabetes or something like that, something that's very common. You'll see that in first year. And then you'll also have shifts in the hospital where you get to actually get involved with patient care. So I'm just going off of what we do in Bristol. But most universities have sort of had this approach as well. And then in second year, you'll start to learn a little bit more about disease processes. So you'll learn about anaphylaxis, you learn about things like problems with the heart. You'll go through each of the systems, problems with the lungs, problems with the GI tract, and then problems with the endocrine system, problems with the brain system, the brain and the spinal cord. So you learn about typical diseases. So things like a heart attack, so myocardial infarction, or with the lungs, you learn about asthma, COPD. With the gut, you learn about lots of different things. You learn about liver disease. You learn about sort of problems with the stomach. You can learn about gallbladder disease, colon disease. So you learn about basically everything that will give you a basic understanding of all of those. You will still do anatomy, physiology, you'll do all of that, but you're learning about the disease process rather than healthy individuals. And then in third, fourth, and fifth year, you're sort of released into the hospitals. You'll all be in different hospitals, and you'll actually be going and seeing patients, developing those communication skills, and actively learning in things like case-based learning or problem-based learning. So that's how it works. And clinical stuff, you also have to get things signed off. So you need to do like examinations on patients. You need to be able to learn to take bloods, put cannulas in, examine patient, do all the different examinations on patients, and you need to be able to catheterize them, understand fluid input output. You need to learn how to do drug prescriptions. So you will learn everything, that all the skills you need to become a good foundation year doctor. So that's what year 3, 4, and 5 are preparing you to do. Okay, I've got a few more questions. Do you recommend doing essay competitions? I don't really know much about them, but if they're medical related and if you think they'll be useful to enter on your personal statement, that is up to you. Is medical art competition good to talk about for interest? Possibly, yeah. How does the NHS bursary work? I would probably go and look on the NHS bursary website and have a read of that. But if I have time at the end, I will answer that question. Okay. Do you know much about the NHS bursary? Yeah, I will answer that later. How to do independent research projects, I think I've just mentioned that. So I think you can do an EPQ, but if you're doing it independently, it can be quite difficult. You can get in touch with places like Nuffield Research or Oxford Research or Cancer Research and see if you can come and just be a lab assistant and help them. And then they can teach you a little bit more about the research skills over the summer. So there's a lot of summer research schools that you can get involved in as well. So see if you can do that. Not a lot of people get into those. So if you don't feel discouraged, because Medical research, you mostly learn it whilst you're in medicine. They don't expect you to know before coming in. Did you do an EPQ and what was it on? I did do an EPQ. My EPQ was not related to medicine at all. Mine was on a piano composer that I really liked. And I was just comparing his work to the art during the Romantic era. And the reason why I did that is because I did GCSE music and I really missed it in A-levels. So I just decided to base my EPQ on that. And it's obviously my hobby. So I knew I was going to be really passionate about it. So that's what my EPQ was on. What work experience did I do? I did a week in obs and gynae, as I mentioned. So with pregnant women and newborn babies. And then in hospital. And then I did 1 week in GP, mostly doing filing and like recording notes, but also sitting in on like vaccination clinics, which was useful. And then I did 1 week of residential volunteering where you go and stay in a care home for a week and you help elderly people or disabled people with daily tasks. And that's through a company called Revitalize. And then I did some volunteering in like a local charity shop, and I'd been doing that since like year 9, so that was like a long-term work experience for me. So those were the things I did. And then I went to some like medical conferences, and also, what was it? It was sort of like a dissection day where they brought in like specimens from animal hearts and animal lungs, and they did dissections, like a live dissection. I can't remember what the company was, but it was advertised through our school, and then whoever was interested was able to go. So I did that as well. Okay, so this is a timetable. So this presentation wasn't made by me, it was made by somebody else, but it roughly sort of follows the same pattern as Bristol. So this was someone from University of Manchester. She's another tutor on 6Med. So this is what her timetable looks like. So you would have something like on a Monday, you would start with your CBL case or a PBL case. So you would get given a case about the disease that you were studying surrounding a patient, and you would open the case. So that's what that means, case to open. You'd be in a group of 10 to 11 people, and you would start reading through the case and start thinking about what the problem is. So essentially what you're doing, you don't get told the diagnosis or what disease the patient has, but it's the case will be written in a format where it says a 32-year-old man has come into the emergency department with abdominal pain and vomiting blood. And then it will give you more and more details as you read through, and you as a team have to work through what the diagnosis is. So it's just teaching you how to come up with your differential diagnosis and how to think like a doctor. So that's what you do in first and second year. So they're opening the case on Monday in the morning, and then usually what you do is you tend to divvy up research points. So anything that comes up in the case that sounds interesting, each person will go and research different aspects of the case and then come back and teach the rest of the group on Friday, as you can see there, where it says PBL case to close, where you're closing and wrapping up the case and also teaching each other about the points that you learned. Other things you can do is things like histology. So histology is basically looking at sections that you've dissected, but under a microscope at a cellular level, whereas anatomy is looking at like a macroscopic level. So that's the difference between anatomy and histology. And then usually the next day after histology, you do tend to have anatomy in the dissection room, and you will do it system by system. So say if you're doing a case on the heart that week, so you'll have a patient who has a heart problem, you'll be looking at heart cells and histology, and then in anatomy, you'll be dissecting the heart. So it'll all be related to a system of the body. And then medication adherence, so that's looking at like drug compliance by patients. Agonists and antagonists, so that's a pharmacology lecture. So agonists and antagonists are different types of drugs. So they're basically teaching you the basic pharmacology aspects of that. And then pathophysiology of asthma. So in this case, it seems to be a respiratory week. So you learn about sort of what is the cause of asthma, how does it actually occur at a cellular level, but also at a clinical level. So what symptoms do these patients come in with? Why do they have those symptoms based on the pathophysiology? Then the next one, you might, on Wednesday, you might have some physiology lectures. So you might have how to actually breathe and how breathing is controlled. So you'll learn about the central nervous system and how that controls breathing. And then blood gases. So that's a type of blood test we do to check for people with asthma, how much oxygen they have in their blood and how much carbon dioxide they have, to decide whether or not we should give them oxygen in the hospital. So interpreting blood gases, basically. Then the next thing is learning about asthma drugs and how to treat asthma in this situation. And then the next one, so usually Wednesday afternoons in all universities across the board, you get time off for sports and exercise. It was just a rule that was sort of posed towards all universities to ensure that people were staying fit and healthy and keeping mentally well as well. So drop-in session, so that might be just to ask questions about a project you're doing. So in this case, it was a poster. And then on Thursday, they did, she has something called Physiology and Pharmacology Practical. So that will be in the lab where you're doing physiology and pharmacology based surrounding asthma, basically. And then on Friday, as I said, you close the PBL case in the morning, and then you'll have a few lectures in the afternoon. So asthma, where are we now? Usually that kind of lecture is an epidemiology lecture to talk about how was asthma treated in the past versus now, and looking at like statistics. So that's what that lecture might be. And they also do some introduction to, I don't know, I can't read what the rest of it says, but they must be introducing some sort of concept to you, which they will then wrap up next week. So that's essentially what a first year or a second year timetable can look like. I would say this is probably more of a second year timetable than it is a first year, because obviously in first year you just learn about healthy individuals, and you'll probably have a lot more anatomy compared to in second year. Can you talk more about Revitalise, please? Yes, I will do. I'm going to park that question. I'm going to come back to that one and to the NHS bursary at the end. Okay, comparatively third year can look a little bit like this. So as you can see, you have no lectures. You may have a few sort of teaching sessions, but it's all going to be in the ward. So Monday morning, you have ward round. So you'll attend a ward round from 8 to 11. That's just following the doctors and seeing all the patients that they need to see in the morning. Afternoon, so she's got some sort of a tutorial there, but you're learning from a doctor, basically. So a doctor will deliver that tutorial based on the week that she's in for that placement. So it seems like she's in surgery that week. So that's kind of what you would cover. Again, so it says OPD, so OPD stands for Outpatients Department. So that will be some sort of a clinic on Tuesday. And then she has teaching in the afternoon. On Wednesday, she's in theatre, so she's watching some sort of surgery in the morning. And then in the afternoon, she's part of a clinical debrief, so that's usually with your assigned group, similar to a CBL group, but it's more of a clinical group where you discuss cases. Again, on Thursday, she is on another ward round, and then she's got anaesthetic teaching in the afternoon. So teaching about different types of anaesthesia and how we can keep people asleep while they're having surgery. And then so she has a prescription revision course. So that's just learning about how to prescribe drugs. And then in the afternoon, some sort of teaching session on hypertension, which is basically high blood pressure. So that's essentially the typical timetable in third year. So you can see in third year, compared to first and second year, you don't really have any specific lectures. It's more just going into the wards and seeing different patients and seeing everything that you've learned from a textbook in first and second year, you're putting that into practice in third year yourself. Fourth year, again, looks a little bit similar to third year. So let's see what kind of stuff she's got here. So it seems like she's on pediatrics and neonatology for this block from the screenshot. So teaching on the Monday, so that's the first day, I think, of the placement. Then on the second day, she's got children's ward handover, so pediatrics, where she's again on a ward round, and then outpatients department is usually a clinic. And then again, must be some sort of ward round again, and then an ethics and law tutorial. Again, similarly ward round, and then she's on the neonatal ward. So neonatal is newborn babies, and then some sort of virtual teaching. And then on the postnates ward, so this is after they've been born, but they're healthy babies, whereas usually neonatal or newborn ward tends to be premature births and people and babies who are quite unwell, they'll be monitored on the neonatal ward, and then finishes off with a webinar on Friday. So you can see the postnatal ward stuff and this sort of overlaps. So usually you will go to this first and then you'll sort of take a break where you watch this webinar and then you'll carry on until 5 and then go home. So there's a little bit more leeway, and it's more like sort of a work timetable rather than a uni timetable. So it is 9 to 5, you're on the wards really in year 3, 4 and 5. So for her year 5, she's again got similar to years 3 and 4. So she's in theatre, she's in a clinic in the morning. She's gone to a biopsy clinic on Tuesday and then another clinic in the afternoon. And then Wednesday she's in theatre and she's in a hematuria clinic. So again, it's just basically theatre, clinic, ward rounds. And then on Thursdays, there's a half day for personal development. Usually that's timed where you can revise or, go back over things you've learned earlier in the week or prepare for the next week. And then ward round, and then she's got other things to do on Friday afternoon as well. With year 5, it's a bit of flexibility. It's about you organizing everything and going in the morning and making sure you get stuff done. You don't necessarily have to be in every day, but you do need to get everything that you need to done. And there's some mandatory teaching sessions that you need to attend as well, but that will be timetabled in for you. So yeah. And they will tell you at the start of your placement what sort of requirements they expect out of you. So in her case, it's 32 hours of clinical experience weekly, which you need to show using a logbook, 8 hours of personal study time, and then taking part in shift work. So again, you need to be able to show all of this in your logbook. So in years 4 and 5, you may also need to do night shifts. So in Bristol, we need to do night shifts in paediatrics. So in the children's ward in A&E, we need to do night shifts. And in when you're doing elderly care or geriatrics, you need to do out of hour shifts. So shifts between 5 and 10 p.m. And when you're in A&E, you need to do evening shifts or twilight shifts, which are between 7 p.m. and 12 a.m. So 7 p.m. until midnight basically is the shift length. So you do have to do a few out of hour stuff as well when you're in medical school. Okay, so I've talked a lot about like the structure of what medical school is actually like. Then going into which medical school is for me. So what sort of factors will be involved in that? Well, one of the first things to think about is location. So what I mean by location is, number one, how far is it from home? Are you the type of person who likes to go home now and then, which obviously is absolutely fine if you want to go home and visit family, are you thinking about like a campus university versus a city-based university? So a campus one, everything is in one vicinity, whereas a city-based university, you'll have different university buildings spread across the city. So you might not have, if you have one lecture in the morning in one place, to get to the next lecture, it might be a little bit of a trek. So Bristol is one of the city universities. I didn't really have any problems in terms of traveling from one area to the next, but it depends on the university you go to, obviously. Where to go as well. So obviously you might have a dream university that you want to specifically go to. As I said, city versus campus. Do you want to be near home or somewhere new and somewhere a bit further away from home? And that obviously will depend on your personality and how close you are with family. The cost. So obviously some cities are a lot more expensive to live in than others. Bristol being one really expensive city. Do you want to be in a large city, or do you want to be in a place where you can also experience rural healthcare? If I were to give a recommendation, I would say city over rural healthcare, only because in a large city, you do get to see almost all of the common medical conditions that you will face as an F1 doctor. Whereas in rural healthcare, you might see some interesting genetic abnormalities, but you may not necessarily see a lot of the common things, and it will be a much smaller patient cohort. And that can limit your learning, especially if you have multiple students wanting to see the same patients. It can be quite difficult in terms of divvying up like different patients to each other so that you all get an equal chance of seeing someone. So I would opt for a larger city. Also in larger cities, you tend to have emergency services which are more active, so you can see common emergency conditions that people come in for, particularly on your twilight shifts, which can really equip you well when you become an F1 doctor, because you might be the F1 on a night shift on your own in the emergency department. So a large city, I would definitely prefer over a rural hospital. Moving for placement years. So this is something that a lot of students come into medicine and then they realize, oh God, I have to be quite far away from the actual university city itself. And they don't like that. So please research this before you say yes to a certain university. In Bristol specifically, the first and second years you are guaranteed to be in Bristol the whole year. In years 3, 4 and 5, you will be split. So in years 3 and 4, you'll spend half the year on an outplacement and half the year on an in-placement. The outplacements include Yeovil, Taunton, Swindon, Gloucester, Weston-super-Mare and Bath. And the in-placements are North Bristol Hospital and South Bristol Hospital. So to make it even for everyone, they usually put you half the year in Bristol and half the year out of Bristol. So if you really don't want to be out of Bristol, because a lot of people do have issues in terms of paying 12 months of rent when they're only in the place for half the year, a few things you can think about: just get a house for 6 months, so temporary rent for the time you're in Bristol, and then the other 6 months you'll get accommodation on the outplacement that you're on. Or if you really want to just be in the city that you're studying at university in, you need to look for a university which offers just placements within the city itself. They're very rare. Usually they all have outplacements like Bristol, but you just need to research that and make sure that you're happy with that. Moving on to the teaching. So there's different types of teaching depending on which university you go to. So looking at traditional teaching first. So traditional teaching is essentially what people used to do. They still use it in places like Oxford and Cambridge, but I think they're all moving to more of a modern approach, just because traditional teaching doesn't actually seem to be as effective as people thought it was. Essentially, it's just learning everything by lectures. So you're being talked at by a lecturer, and then you go and see people on placement. So it's only lectures and placement. So it's very, very similar to how you have teaching in schools. But when it comes to learning very, very complex issues, complex topics in medicine, a lecture-based approach doesn't work for a lot of students, and a lot of students prefer PBL or CBL. Which is where you do small group learning as well. And if you do have any doubts, you can bring it up and teach each other. And in that way, anything that you may not have been able to clarify in a large group lecture-based teaching, you can do in your small group teaching. So usually they're clinical case-based. So you'll get a clinical case and you need to solve the issue that that person has. So it's similar to the way in which doctors learn. And that's why people prefer it, because it equips you very well once you become an F1. An integrated approach is even better than a PBL, and that's the one that Bristol, Cardiff, King's, all of those universities are starting to use now, where you get a mixture of lectures plus this case per week. And this is what, as I said, most medical schools use. So just going over them again. So traditional lecture-based with a strong focus on the basic sciences. But the problem with this approach is that once you come into clinical medicine, you don't necessarily sit there and talk about each of these topics at a cellular level. You need to be able to put the topic into the context of a patient and help them understand what's going on in their body. And you're not going to be able to say, okay, so with asthma, this particular cell is not working. They won't. It's just not the way to sort of clinically explain something to them. So rather than thinking about things on a cellular level, you really need to think about it in a patient level and in a patient-friendly language. It really puts your scientific knowledge first, followed by your clinical knowledge. But the problem with that, it's quite disjunct, as I said, and it's hard to translate that once you go on to clinical placement. It involves a lot of essays, lots of written work. So it does equip you for things like research in the future. But then again, when you're doing PBL-based stuff, you still learn research skills anyway. So that's why I don't really like this mode of teaching. Moving on to PBL based, as I said, we've got clinical case-based teaching with small group discussions. You will have a tutor there. They're not there to sit there and teach you everything. They will just sit in the back and moderate whilst you guys are the people leading it and trying to understand the case. This is similar to the way in which doctors learn in a multidisciplinary team. It's quite hands-on and there's fewer or hardly any essays to do. It's sort of seen in most medical schools. Okay, so ways to apply and how to strategically apply to maximize your chance of actually getting into medicine, because as we know, it's quite difficult. Think about your strengths, think about your UCAT score. So in terms of strengths, what I mean is if you know that your personal statement writing skills are really good, and if a specific university weights your personal statement mark at a higher level compared to your UCAT, obviously apply to that university because you know one of your strengths is your personal statement. On the other hand, if you've got a really high UCAT score, you have a better chance of getting into those universities which look at your UCAT score a lot more than other aspects of your application. So apply to those ones. If you haven't done so well, apply to universities which don't look at your UCAT as much and look at other things like personal statement and work experience. So you need to be tactical. Yes, you might have a dream university that you want to go into, but at the end of the day, if you don't get the UCAT score or if you don't get certain things which fit in with the kind of things they're looking for in their university, it'll be difficult for you to get in because there'll be so many people competing with you. So that's why to maximize your chances, be strategic. Again, same with BMAT score. Is it high, low? If you did badly in BMAT, maybe you should focus on applying to just UCAT universities. If you've not done so well in UCAT, but you have done well in BMAT, maybe you should maximize your chances by applying to more BMAT than UCAT universities. GCSEs, so some universities take GCSEs into a lot more account than other universities, one of them being Cardiff. They grade them using a point system based on how many A stars or 9s or 8s you get, and they then decide who to invite for interview. So GCSEs have a very heavy weighting in Cardiff. I'm not sure if they still do, but they did when I was applying, so just double check the university website. Interview, so what percentage of your mark goes towards the interview, and that can then decide how likely you are to get a place as well. Just remember that all medical schools are good medical schools. As I've been saying over and over again, yes, you might have a dream university, but just because you don't get into it, it doesn't mean that you're going to come out a worse doctor compared to someone else who did go to that university. My dream was to go to University of Edinburgh, but unfortunately I didn't do as well as I thought I would in the UCAT, and therefore decided not to apply for it and to give myself more of a chance by applying to different universities. And you just have to be realistic and not lose hope. It happens to everyone, but it's just making sure that, yes, you will get emotional in the moment about the UCAT score and about the fact that you wanted to go to that specific university. But in the end, you have to realize you still can give yourself a really good chance by strategically thinking about what you want to do and then thinking logically and practically rather than just emotionally when you come to deciding where to apply. Other things to consider are what kind of university you actually want to go into. Do you want to learn the skill of being able to dissect, or are you happy with just prosections? So the difference between dissection and prosection, so dissection, you're actually doing the cutting. Prosection, someone else has already cut the specimens for you and you're just looking at them and learning from them. There are pros and cons to both. So dissection, obviously you learn those hands-on skills, but the problem with that is you might cut the specimens wrong, and therefore it's not actually very useful to your learning, and you're spending a lot more time cutting rather than actually learning from the anatomy of specimens. Whereas with prosection, the good thing is the fact that someone's already done all the hard work for you, so all you need to focus on is learning the different structures and the names of the ligaments and the veins and the arteries and everything, which is very, very complicated. But obviously you don't get those hands-on skills that you would in dissection. Early clinical experience, how early do you want that? I always say the earlier the better. So in Bristol, the first week of medical school, you get clinical experience, and then from then onwards, it just builds up and up. Some universities only start clinical experience from third year, and a lot of people are put off by that because they feel they don't have enough skills to be able to communicate with patients properly because they haven't done that in first and second year, or they haven't practiced that, and then being thrown in completely to do it in third, fourth and and fifth year can be difficult. So be tactical in choosing the universities. Intercalation, do you want to have the option of intercalating? In which case you can go for a 5-year course and then decide in 3rd and 4th year. Or do you definitely know you want to intercalate, in which case you can do a 6-year course, which has compulsory intercalation as part of it. Extra qualifications as well. So I think that's part of things like intercalation. The course length, again, that links back to intercalation. So do you want to do it for 5 years or 6 years? And then extracurricular stuff. So things to consider outside of work as well. So what sort of medical societies you want to get involved in. All universities tend to have some level of a medical society, because obviously medical students have a much more hectic timetable compared to non-medical students. So these medical societies have created their own football society, their own rugby society and things like that for medical students only. So they still make the time to do those sports amongst their busy schedule. So look at the medical society, see if you like the vibe of it and which one feels more inclusive to you and which one you think you would do well in. And other societies you might want to get involved in. What's the nightlife like, is if that's something you're interested in. Not everyone is interested in the nightlife, so you don't have to sort of look into that and factor that in, only if it, you know, means a lot to you. Days out, so from the city you're living in, what kind of places can you go to and see on the weekends to try and relax? Part-time jobs. So a lot of people say when you're doing medicine you can't have a part-time job. I think that's completely false. I have this job, so working in SixMed and with uni admissions, and I also do tutoring, and I've done I've done graduation events, I've done university work with the university. I've done, you know, when people are doing their medical interviews, I've like registering them in and also interviewing some students. So I've done a lot of different jobs whilst I was in medical school. It's absolutely doable. You just need to be strategic and you need to be very organized with your time in order to be able to balance everything and do well in all aspects. It's difficult, but once you find and really understand that organization skills, you will be able to do everything. It is not impossible. And also I think it's a good thing to do part-time jobs because it really teaches you the value of money, and also it teaches you about realistic life skills, which you tend not to really learn in medicine, but you need to know it once you've graduated. So yeah, I'd encourage anyone to try and get a part-time job. You don't have to get just a general part-time job. You can even get a job as a HCA, a healthcare assistant in the university, hospital that you're studying in, and you do get paid a lot for weekends. A lot of my friends do it. So, there's a lot of different things you can do which fit around your schedule. So things to consider when applying. What dates are important? So UCAS application needs to be submitted by 15th of October. And you need to do your UCAT exam before then. And your BMAT exam, I think the dates are changing at the moment. I'm not too sure off the top of my head when the BMAT exam is, but obviously I think it's usually after the UCAS application deadline. Interviews run usually between November to May or November to April. And offers can happen anywhere between November to April, only because they are interviewing so many people. So some universities tend to wait until the end, so until April, to tell you whether or not you've got in. Some universities, if they really, really like you, will tell you, a week or two after your interviews, but the timeline can absolutely vary. And just because you've got like a really early interview offer doesn't mean, or if you've got a really late one, that doesn't mean you've done badly or really well compared to somebody else. It's just that they've had to process so many applications. Okay, so if you are, today obviously you guys have attended the session because you are considering medical school, considering applying. Hopefully this presentation so far hasn't put you off applying it. The next thing to think about is between July to September is obviously think about things like your UCAT and your personal statement, and whether or not you would like to do the BMAT. And then on 15th of October, obviously you have to submit your UCAS application. And then you need to think about, obviously, during this period, learning BMAT, if that's an exam that you're thinking of sitting. And in November, starting, or earlier than November, starting some interview practice so that you're prepared just in case you do get an interview invitation. Okay. Next thing, so between November and February is when you have your interviews, and then between February to May, anytime between that, as I said, you can get your offers. And then obviously in May and June, you're sitting your A-levels. Okay, between mid-August is when you get your results, and then that's when you know which university you're going to. And then mid-September, so it's usually the 3rd week of September, you start university. So writing your application. So I think I have a few questions, so I'm going to just focus on them first. Hang on. Do you get any choice between where you go for out and in placements? Yeah, so you get a preference form that you can fill out, particularly in your final years. And if you have extenuating circumstances, you can ask to be placed in certain placements so that you can save money, or you can be closer to family, or whatever it is. Can I ask what's the difference between medicine and pharmacy? And for pharmacy, can you do a different undergraduate degree first, followed by MPharm? I'm going to be completely honest, I don't know too much about pharmacy at all. I think that maybe look online, look on the UCAS application website to see and check, the difference between pharmacy and medicine. I guess pharmacy is more, they'll focus on the drugs itself and like clinical experiments and trials of drugs. So I think I would advise you to check online, because I'm not confident in answering that question. Do they do full body dissection in Bristol? No, they do prosection in Bristol. Are dissection students better surgeons in the future? Not necessarily, no. Prosection is just as good as dissection. If you really want to develop your dissection skills, you can always go to courses for that. Would you recommend giving tuitions medical student to high schoolers to earn money? Would that be financially viable? And would you have enough time? Yeah, you can do that. You can do that either through companies, so you can set your own times and when you are available to tutor, or you can just do it privately. It is up to you. How long would you spend prepping for UCAT? So my exam was at the end of the last day of August, and I started revising end of June. So just over 2 months, but it will vary from person to person. Can you talk more about Revitalize? I will at the end of the session. I'll come back to it. Okay, UCAS choices. So for UCAS, you can apply to 4 medical schools. The last choice has to be a non-medical choice. So that can be something like biochemistry, biomedical sciences, chemistry, or whatever it is. But it has to be science related, but it can't be medicine. And you can only apply one personal statement for all of these medical schools. So please do not do any specific writing for a certain medical school over another. Keep it a bit generalized. And just answer, the main thing you need to answer in your personal statement is, why do you want to study medicine? That's what they want to know. And what commitment have you shown to a medical career? As I said, you need to submit by mid-October. Personal statements, the structure of it. So there is a session where we go through sort of the specifics about how to actually write a personal statement, which I think is done a bit later on in these 6 med surgery sessions. But for now, the things you need to know is it obviously involves an introduction where you're talking about your initial spark into medicine and why you want to study it. It's 4,000 characters in total, so characters, not words. So what I mean by characters is each letter counts as 1, and every time you use a space or a punctuation mark, that counts as a character as well. So actually you're very limited in the amount you can write. So that's why I'm saying be really tactical in the examples you choose to make your personal statement really strong. What you're trying to answer, as I said, is why medicine. Talk about your work experience and how you've shown commitment to medicine. Other experiences, so this can be your hobbies, extracurriculars, and what you learned is more important than what you did. So again, I'll say that. So the things you learned from your experience and your ability to reflect on your work experience is more important than how many things you did. So try to avoid listing in your personal statement, which a lot of people tend to do because it's just boring to read and it doesn't show any level of reflection. So talk about what you learned and how that inspired you even further to study medicine. So work experience. As I said, it doesn't necessarily have to be medical, can be non-medical. Obviously, secondary care or hospital placements are very useful because it gives you a realistic insight of what you will be doing in the future as a doctor. But at the same time, other things like working in a cafe or having a part-time job also counts as work experience because it teaches you all the transferable skills that you need to know for medicine. So you can still use that if you're unable to get hospital experience. You can work in a care home and you can also work in GPs. So let me go back to that question about someone asked about Revitalise. So Revitalise is a company where they have 3 residential care homes. I think they have one in Scotland, one in Southampton, and then one in Essex. And essentially they are care homes where people who have either learning disabilities or people who are really elderly and frail, and they have things like dementia, come here for a week. And usually what essentially happens is the family who are looking after them are going away on holiday for a week, for example, and this particular individual is unable to go because of their health issues, and therefore they come in to Revitalise to be looked after for the week whilst the family can go and do what they want to do. And essentially what the way it works is you as a student can sign up for 1 week or 2 week placements. You are provided with accommodation and food, and essentially you're a volunteer where you will do things like helping those individuals, those people with learning disabilities or dementia or Huntington's disease or whatever it is, whatever health condition it is that makes them not independent in their daily living. You just help them with their daily tasks. So that could be things like feeding, it could be things like just making them teas, sitting with them, offering them company, speaking to them. It could be taking them on days out. So usually in Revitalise, they do a few days out where I was in the Southampton one, so they did cruises or just a day out in the shopping centre. So you will probably have to push their wheelchair and just take them around. And it's just sort of interacting with them in a more long-term level than just doing 1 week of work experience and like just seeing a snippet of different patients. You do tend to build quite a good relationship with these individuals and learn a little bit more about their medical conditions and develop your communication skills and things like that. So that is what Revitalise is. And then you might also be asked to do lead some bingo nights for these elderly individuals. And it's just sort of a holiday for the patients who come as well, but also a nice way for you to make a difference for them. So that's essentially what Revitalise is. I'd definitely recommend if you are close enough to be able to go there. Admissions tests. Okay, so UCAT obviously is the main one. So this is the one that most universities request. And it's a 2-hour exam with 5 subcategories. So you've got verbal reasoning, quantitative reasoning, decision making, you've got abstract reasoning and situational judgment. So those are your 5 subcategories which you need to study for. Usually it's about skill over knowledge. You can't necessarily sit and revise for this exam. It's more about being able to work under the time pressure and being able to, I guess, be tactical in the way you read those questions and answer them. So with verbal reasoning, you'll get given a long passage, but what you shouldn't fall into the trap of doing is reading the whole passage. You need to read the question first, look for keywords, and then find the answer in the passage and move on. So it's all about sort of working under those time pressure conditions. You get the grades on the same day that you write the exam. It's a computer-based test. And as I said, these are the 5 sections involved with it. So I've mentioned verbal reasoning. Decision making is essentially like problem solving, and quantitative reasoning is your maths. So be very, very good with your mental maths and practice that. And remember your percentages and percentage conversions and percentage increase, decrease, all of that stuff, all of your GCSE based maths knowledge they test. Abstract reasoning is a little bit like non-verbal reasoning, if anyone's done that. So you're recognizing different shapes and different patterns within those shapes. And then situational judgment is very medically. So it involves a lot of medical ethics. And I would really recommend people to read the GMC guidance to a good doctor, because if you read that, you're definitely going to do well in this. It's very, very difficult to fail this section of the exam. And it's marked in a different way to these 4 sections. So these 4 sections are marked out of 900 each. So this one out of 900, 900, 900, 900, whereas this last one is banded. So band 1 and 2 usually good, band 3 and 4 usually bad. So band 1 is really good, so you know essentially how to behave as a doctor. Band 2 is just good enough. Band 3, people tend not to get as many interview offers if they get a band 3, and band 4, again, people tend not to get many interview offers. It's essentially testing whether or not you would be safe as a doctor and whether or not you understand medical ethics. Is it free, or what sort of cost? Revitalize is free because it's a volunteering program. Okay, BMAT. So this is, so 2023, so this year is the final year that BMAT is being used. After that, I'm not sure whether they're bringing in a different test format, but they are making a lot of changes to it. It's only used for a handful of unis, so things like Oxford, Cambridge, UCL, Imperial, Brighton and Sussex and Lancaster, and I think one more, but I can't remember off the top of my head. Again, it's a 2-hour exam involving 3 different sections. BMAT, some people find it a lot easier than UCAT because you can actually revise for it. So it tests biology, chemistry, physics, maths and physics, and your English writing skills. So essentially everything you've done at GCSE level with your sciences, maths and English. The 3rd section is an essay. So if you're not that great at essays, obviously make sure you practice them if you decide to do the BMAT. And as I said, they ask for GCSE level science and logical questions. You do get the grades get directly sent to the universities and then not released immediately after your exam, because it's a written exam, like a paper exam. It's usually released like on a specific date, and that will be, you'll be able to see that on their website when you're applying. Okay. Moving on to interviews. There's different types of interviews as well. So it is very complicated, the whole medical application process, but I would advise thinking about it in small chunks so that you don't get worried about the whole application process, because it can be quite anxiety provoking, which is completely understandable because there's so many things to do before getting into medicine. But just take it in small chunks and small steps and you'll be fine. So different types of interview. The first type is a panel. So that's a very traditional based interview approach, where you have one interview with 3 different interviewers, and some questions, there's some level of variety in the questions that you get, but they mainly tend to be academic, like why medicine, why this university, tell me about this medical topic. So it'll be very academically inclined. Again, as I said, you have same interviews. The interviewers usually are like, one of them is a very junior individual, such as a medical student or an F1 doctor. And then the other person would be a lecturer. And then the other person would be a very senior clinician. So that's the variety of different people you can get. It tends to be longer, tends to last about 30 to 40 minutes in total. And it's very, very similar to like any job interview that you would expect. On contrast, MMIs are much newer and much more preferred by universities these days. They're called multiple mini interviews, lasting between 5 and 10 stations. So essentially you start in one station, you get asked one theme of questions, and then you'll have a certain amount of time to answer it in. So whether that's 5 minutes, and then you have 1 minute to move to the next station, and you'll have a different interviewer asking a different question about something else, and then you'll keep rotating around stations. They tend to be quite short, so as I said, 5 minutes to 6 minutes with 1 minute reading time and 1 minute rest time. And you'll get a wide range of things. So you won't just get the typical questions like why medicine, why do you want to study here? You will also get very weird questions like one of the ones I got was, by 2050, there'll be a 50% increase in the number of flights. How is this going to impact medicine and doctors, and you sort of do have to think a little bit outside of the box. So they're quite creative questions. You can also get asked things like, there's a man who's come into A&E, so they'll give you a case essentially. There's a man who's come to A&E who has lost a lot of blood. He was in a road traffic accident. We need to give him a blood transfusion, but he, you can see on his ID card that he's a Jehovah's Witness. What would you do in this case? So they would expect you to have a good understanding of your medical ethics and also what you would do in that situation in order to be able to answer those questions. So when you come to interview practice, you will encounter how to answer ethical questions. The way to do well in these is to have a good structure that you can fall back on. And for different stations, so for ethics station, there's a certain structure you can follow. For things like why medicine, why this medical school, there's a certain strict structure or certain things that you need to mention in order to, you know, score those maximal marks. As I said, different examiners for each station. So what types of stations can you get? So you can get the academic stations, as I said, like science, testing your science, maths skills. So they may ask you to do some drug calculations to find out, you know, the dose of a drug that you want to give to a patient. That is very, very common in Cardiff. They really like to test your maths. They may ask you questions about yourself. So what are your interests outside of medicine, or what are your interests related to medicine? So that, again, hobbies. They might ask you very, very specific questions about your work experience. They may ask you about the medical school itself. So it's really important to prepare. And the reason why it's important to prepare for these questions is because they are asked at every medical school. So if you prepare for one of them, you're essentially preparing for all your medical interviews, and it just becomes really easy to get the marks for these questions. And also, you have written about all of these factors in your personal statement anyway, so these should be your easiest questions to answer in an interview. As I said, again, linking back to that, know your personal statement. They might ask you questions like what makes a good doctor? So again, link back to your work experience. Obviously, things like knowledge is important, but also having that patient skills and those communication skills in order to actually speak to the patient in front of you. Empathy is another one, compassion, linking back to empathy. Leadership and teamwork is important. Problem solving is also important, and so is resilience. Okay. BMAT Ninja's a recommended resource. Yeah, I do recommend that one. It's quite good. Ethics and current debate. So this is a specific set of questions you could get asked. You're not going to get asked all of the different types of ethical scenarios, but you may get asked one or two. But obviously remember to prepare for all because they are quite complex. Always remember the 4 ethical pillars. So some of you may know it already. So it's autonomy, beneficence, non-maleficence, and justice. So what you need to do is not just know what they are, you need to be able to incorporate that into the ethical scenario you're discussing. So autonomy is the patient's right to be able to, you know, say yes or no to a treatment or know more about their medical condition. Beneficence is the doctor's duty to do good for the patient. Non-maleficence is the doctor's duty not to harm the patient, and justice is to treat everyone fairly and equally. Professionalism will also be tested as part of ethics, and consent. Consent goes hand in hand with the concept of autonomy. So everyone over the age of 18 is assumed to have autonomy or the right to say yes or no to their treatment. And saying yes or no is essentially what consent is. So they're consenting to having things done as part of their medical treatment or medical care. But if a patient doesn't have autonomy, they can't consent. So they may ask you questions related to that. For example, if it's a 13-year-old child, you need to decide whether or not they have competence and whether they have autonomy in order to be able to consent to treatment. So those are some complex ethical scenarios you may come across. Confidentiality is another thing. So a common question is, patient is now HIV positive. Do you or do you not tell the partner? And confidentiality will come into that argument. Resource allocation is usually testing your knowledge of justice. So you've got 1 liver, but you've got 2 patients. Who do you give it to? You've got a 49-year-old man who drinks, and you've got a 13-year-old boy who has an autoimmune condition, no fault of his own, but he needs a liver transplant. So who do you give it to? So resource allocation is one of that. And along with the resource allocation is some decision making as well. They may ask about role play. I think role play really depends on the university. Some universities really love it. Some universities just tend not to really use it. It could be a medical role play where you're playing the doctor and you're expected to break news to a patient or speak to a patient about something. Or it could be an ethical role play where you have to tell someone that they're not getting the liver or they are getting the liver or something like that. So yeah, breaking bad news, that they could be really mean and ask you to break bad news of a cancer diagnosis to someone. That is a really hard one, but they may ask you to do it. The model I like to use is called SPIKES, so SPIKES when breaking bad news. So SPIKES stands for, S is for just discussing the situation, P is for the patient perspective, I is inviting the patient to discuss the topic, K is checking the knowledge of the patient and updating them on what's happened so far, E is empathy and emotions, so letting the patient vent if they get really upset about the diagnosis, and then S is summarizing and making plans on what to do next. So you can look that model up online. So it's SPIKES, SPIKES. Essentially what they're testing you on is your communication skills and your person interaction. And even if you don't know exactly what to say, if a patient asks a question or if the actor asks a question, you can just say, I'm not too sure about that, but I can go and speak to the multidisciplinary team and get back to you on that. And we can arrange another appointment to discuss this. So yeah, if you don't know the answer, it's not the end of the world. They're not testing your medical knowledge. They just want you to be able to show empathy and deal with things under pressure. Then, as I said, like the flight question I got asked, you can get some weird and wonderful questions to throw you off. One thing to do is to try and stay as calm as you can. So I know in some universities, I think it was in Hull, York, they did a 21 questions and where the interviewer is thinking about something and you have 21 questions to ask them in order to find out what they're thinking about. It could be about interpreting art. So they give you a picture and they ask you to interpret it. They can ask you about brain teasers, or they can ask you just generally to talk to a patient with a chronic health condition. So top tips for interviews. Most interviews are essentially to test your ability to communicate, not how much medical knowledge you know, because obviously that's what you're coming to learn the medical knowledge in university. They don't expect you to already have it prior to interview. So all they're testing you is on your communication and your confidence. If you don't know an answer, move on to the next station in an MMI, for example. And also, if you feel like you've messed up in one MMI station, that is not the end of the world. Forget about that station and move on to the next one. Because if you don't do that, and if you constantly replay what you did in the station that you didn't do so well on, you are not putting your full concentration into the MMI station right in front of you, and therefore you can lose marks on all the rest of the stations since that bad one. So be really careful not to fixate on a bad mistake and move on to the next one to try and maximize your chances of getting full marks in the rest of the stations. If you're told to prepare on a topic, then make sure you do. This year in Queen Mary's, they released an article to the people who are being interviewed about an ethical topic. You were expected to read the article and they were going to ask you random questions based on the article. So if they give you material to prepare for in advance, please read it and prepare, because it's easy marks, especially if you can think of possible questions they could ask you based on it. And as I said before, be confident, be calm. It's very hard to do if you've never done interviews before, but the more you practice, the more confident you'll get, and you'll understand the structure of these interviews better. So what comes next? So after you've done all of this, so over the year or so, you'll get your firm and your insurance choices on UCAS. So your firm choice is the first choice of the university you definitely want to go to, and the insurance choice is usually the choice which, if you don't get the grades for your firm choice, you can fall back onto the second choice, which is your insurance. So make sure that you're tactical when you're doing your firm and insurance choices. So your firm choice should be the one which If you get like your highest marks, that's the one you're going to. But your insurance should, the sort of conditions on the grades should be slightly lower. Don't have your firm and insurance choice with the same expected grades. Try and make sure you give yourself a bit of a chance. And with the insurance one, it can be an AAA instead of an A-star AA. So just make sure that you're being fair to yourself. And then after you've done these choices, once you've got your firm choice or your insurance choice, you start thinking about accommodation at the university, thinking about applying for student finance, thinking whether or not you want to defer your entry and take a gap year. Okay, so what do you do if you don't get an offer? So what are your plan B options? Make sure that you consider reapplying. Will you reply to medicine? Try and get feedback from the universities who did reject you, whether that was pre-interview or post-interview, about what you could have done better to try and get that offer. Try graduate medicine. Maybe you want to do a different degree like biomedical sciences and then switch to graduate medicine. That is another option. You can transfer your course, so you can start another degree like biomedical sciences, finish first and second year of it, and then for your third year you can jump straight into third year of medicine, because in first and second year essentially biomedical sciences and medicine learns the same things. They learn the same stuff, so you'll be on the same level as a third year medical student. So some universities do give you the opportunity to switch to third year medicine, one of them being St. George's. Or after first year, depending on the university you're going to. Or you can just think about another career path if you've had enough of medicine and you think, actually, no, this isn't for me. You can do other careers in healthcare, whether that's pharmacology, pharmacy, dietetics, nutrition, all of that, still healthcare roles, but just different healthcare roles. So you will still be part of the multidisciplinary team with doctors, you'll just be a different individual within that MDT. And these can be less competitive with shorter training, and you may start work earlier as well, and be able to move up the career path a bit faster compared to medicine. So that is something to think about. All of these are very big decisions to make when we're really young, and that's why medicine can be quite a difficult degree, because you're committing very early on to what you want to do. So obviously, be kind to yourselves and make sure that you're thinking about all your options. So top tips for medical school. Make sure you have an open mind. Don't close off your once you get into medical school, don't think, okay, I don't like the concept of being a GP, I'm not going to ever do it, and I'm not going to be enthusiastic in those placements. Try and keep an open mind, because you could change. You could think, actually, no, GP is a great option. Or you might initially think GP is really good, and then you might end up not liking it as much. Make sure you just have that flexibility and don't fixate on one specialty, because it's really hard to know what you want to do when there's so many specialties available. So when I first started uni, I didn't really like GP, and then once I actually started doing GP every week, which is what you do in third, fourth and fifth year, you have GP placements every single week, and you see what they do, it just, and the kind of work-life balance they have, it really did interest me, and it sort of opened my mind a little bit more to that career. Get stuck in. So any opportunities they give you, just make sure that you take full use of it. Remember that you're the ones paying for your own degree. So if you don't turn up, that's your money, it's not anybody else's. So just make sure you maximize the opportunities that they do give you at university. Ask lots of questions, again, help each other. There is a tendency in medical school to sort of, I don't know what the word is, but not be very competitive and be, I guess, not very nice to each other. But in Bristol, we tend to be quite friendly with each other between years, but also within our own year, we tend to help each other a lot, and it just makes for a really nice environment when you're learning. So just look out for one another. And as I said there, so that was great timing, and try not to compare yourself to others. So one rule that I have for myself is just not to ask anyone about what marks they've got in their exams. It just makes me feel, it just makes me able to just focus on my exam results alone and not anybody else's. And it also prevents me from comparing myself to anyone else, because at the end of the day, I'm in medical school to improve myself and make sure that I'm a good doctor, not to compare myself for the rest to others for the rest of my life. So it's really easy to compare yourself, but try your best not to do it. And one of the things that I can recommend doing is to just not ask your friends what exam score they got, and then yeah, that just completely avoids that whole issue. Okay, and then be proud of yourself as well, because it's a lot of things to do to get into medicine, and it requires a lot of resilience to stay in medicine. So to be able to do that, you know, you are quite strong character, and therefore you do need to be proud of yourself and give yourself some credit. Okay, questions. I can see 6 of them in the Q&A, so I'll start by answering those. Anyone else have any other questions? Feel free to add them as we go along. Do you know much about the NHS bursary? How does it work? Yes, I will answer that one now. So NHS bursary, if you're doing a 5-year degree, you can apply for it in your last year, so in your 5th year. If you're doing a 6-year degree, so if you've intercalated, the last is in your 5th year and your 6th year, you can apply for the NHS bursary. Essentially, the NHS will pay for your tuition fees directly, so they will liaise with your university and pay your tuition fees. And they also give you a grant, so this can be means tested or non-means tested in those years where you apply for a bursary. So a non-means tested grant is any student is automatically eligible for £1,000. You don't have to pay that back. That's for you as part of your maintenance. Because what happens with medical students is in your last years of medical school, your maintenance loan drops. And to cover that and make sure you still have enough money for food, accommodation, all of that stuff, the NHS gives you £1,000 as a bursary, not as a loan, as a bursary, so you don't have to pay it back. The other thing that the NHS bursary also does, if you are on it, by the way, only home students can apply for an NHS bursary, international students cannot, just to clarify that. The people who do have an NHS bursary for that academic year, if you are doing very long distance travel where you have to pay a lot of money to get to your placement, you can get that money reimbursed by filling out a form, whether that's in car, so you can get miles. So I think it's 5p per person per mile. So that does come up to a lot of reimbursement back to you. And if you're taking the bus as well, or any other form of public transport, you can get that reimbursed depending on how far it is. So obviously check that with your university. I think that's the main things about NHS bursary that I can think of. If there are any other questions, feel free to add them and I can answer them. It's not something to worry about in your first 4 years of medicine. It's only in your last year or your last 2 years. So I wouldn't get too worked up about it, but it is there for people who are worried about coming out with a massive loan. You're not going to, you will have some sort of bursary. I've done a lot of tech-related activities. How do I relate it in my personal statement? Talk about the ones which are most relevant and which have given you the most transferable skills into medicine. Do you know about the CCIR? Is it a research program? In case you don't, it is a research program. In case you don't, any tips on how to have a good application for a research program such as this that relates to medicine? I guess you can talk about what kind of skills you want to learn. So understanding and interpreting medical stats, and also maybe wanting to get involved in writing scientific papers, because they're very different to writing other types of papers, and then like getting involved in publishing. So that's the kind of things you could talk about in your application. Can I ask what's the difference between medicine and pharmacy? Yes, I will come back to that question. And can you do an undergraduate degree? Yeah, so I think this is the question I answered before, and I said I'm not too sure. I think it'd be worth maybe looking online. Okay, even though it's not guaranteed, am I able to call up universities and see if there's any places that haven't been taken up? Planning on reapplying anyway, but just wanted to see since there's nothing to lose. Do you know anyone who has? Thank you very much. Yes, so that's called clearing. On the day you can call up universities and say, are there any spaces? These are my grades. I would like to come. They're not going to give you a space straight away. They will still want you to interview. The interviews are usually last minute, as in if you call them on a Wednesday, they will want to see you the next day on Thursday. So the turnaround for interviews are very, very quick. So you need to be ready and on it for those interviews. I do know 1 or 2 people who have done that, and they went to St George's. And also a few days before your A-level results are released, you get I know certain universities will say medicine for clearing. They will say whether that university is going into clearing for medicine. So make sure you give yourself a good chance of getting in through clearing as well by actually checking all those university websites and seeing which ones are actually going for medical clearing, as opposed to which ones are not, because there's no point waiting in line and it's a long time before they pick up the phone, because there's so many people calling all at the same time to try and do exactly what you're doing, but not just for medicine, for all other courses as well. And so you need to be really on it. So just make sure you give yourself a good chance. Just pick the ones that are already going into clearing for medicine, because otherwise it's just stupid to be waiting in line when you know they're going to say no. So some universities will advertise, some won't. So obviously it is a bit of a gamble. But I go for places where they advertise and they say, this year we're taking students through clearing, so please call us. So call them first, and then you can see if you can call other people. So. Okay, a few more questions. Are there any socials to ask for questions if we need help? What do you mean by that? What sort of things? If you can just elaborate on that a bit more. I'll just move on to the next question while I give you some time to type. Are UCAT cutoffs for different unis available at the uni website, or do you have to look elsewhere? It's on the uni website. It should be on there. They have to post it because it then gives you an even chance of applying to different places. If there's any other questions, post them in the chat as well. Are there any social media to ask for questions if we need help? They might have some on the university social media, so University of Bristol or University of whatever, and they might have like specific social media accounts for Bristol Medicine or Cardiff Medicine or whatever medicine. So you can ask them questions through there possibly. I'm not entirely sure, if I'm going to be honest. I think you're going to have to do some research into that. If everyone's happy with everything else that was covered today, feel free to go. If you still have some questions, feel free to stay behind and ask them. Could you talk about interviews that involve problem solving, where they give you a problem and you have to work through it on the spot? It's literally just similar to like a maths question where you have to show you're working out. You just need to talk through what you're doing step by step. Even if you get the answer, they're not expecting you to, number one, get to an answer, because they might give you a very complicated problem and you're not always going to get the right answer. And again, they're not expecting you to get the correct answer. If you do, that's great, but they're more concerned about the way you think and how you communicate that to them. And if you get stuck, you can just say to them, to be honest, this is what I'm thinking so far. Is there anything else, any information you can give me to get some context about this problem? And then they might give you some help, they might not give you help. So if they don't, just say, okay, so this is what I think, and stop there. If they do give you a little bit more help, then obviously you can discuss that as well. Do you recommend an iPad or a laptop for uni? Personal preference, really. With an iPad, you can still get a keyboard and a pencil, Apple Pencil, or whatever, can't you? So it's really personal preference of which one you work best on. Any other questions? Did you use any resources for your A-levels? I can't actually remember what I used for A-levels. I think it was mainly the textbooks that were given at school, and maybe some videos online, mostly past papers. I think that's what I used. Okay, so I'll leave it there if there's no other questions.